Today, it's absolutely critical to embrace the digital world and move to a more effective way of working. Many organisations still use very paper-based manual processes, and it's a major challenge to turn paper documents into digital records. EDM have been helping our clients achieve their digital transformation journeys, bringing all of their data into a secure and central portal to provide their whole organisation with instant access to the information they need to enrich their own customers' experience.
What EDM does is actually a fairly simple thing. We digitise paper records. We turn paper into electronic documents, but it's surprising how complex that can be and the level of trust and understanding that you need. We started life over 30 years ago as a scanning bureau and became one of the biggest scanning bureaus in the country.
EDM is a digital transformation company and we look after the complete end-to-end cycle of documents. So from physical storage to scanning, bulk scanning, to more complicated digital transformation solutions and mailrooms.
Just keeping up with new orders and records can be a real stumbling block. It's critical that nothing is left behind. EDM use proven technologies, providing you with a complete document scanning and management solution, including a digital mailroom, record handling and document printing for outgoing communications.
EDM's role is to scan paper records, but there are a lot of other digital processes going on in the background, and more clinical processes are becoming electronic. So over time, the need for paper will become less. It is calculated that currently the NHS create 500 million pieces of paper a year, but that will go away.
Recently I had the experience of the NHS myself. It was a really interesting experience to see the reality of the NHS at the moment and the challenges it has. Obviously what you could see is the majority of the staff are so dedicated and hard working in what they're doing, but the environment they're in of budget constraints and pressures is incredible. So I think that makes it ever more important that we bring technology and digitisation into the NHS to take away things that are not core caring for patients.
It's calculated there are 10,000 full-time staff looking after medical records. The space that those records takes up is the equivalent to 30 football pitches, and the cost of sustaining that to the NHS is £300 million per annum, or half a percent of total NHS budget. So there are considerable pressures on the NHS to save money, and EDM will work with them to digitise their medical records.
EDM have worked with some of the biggest organisations in the UK, including government departments, NHS trusts, banks and major financial institutions. We have a proven track record in delivering real change and tangible benefits. Our customers have been able to become truly paperless, cut costs and risk, and handle critical information and processes more efficiently.
It's estimated that if trusts can free up the space that their medical record libraries take, and the staff that are involved with looking after those records, they can after the initial investment's been made, they can save between £1.5 million and £3 million a year, every year. So it's substantial, and it's worth going down that route.
I think this is about NHS trusts concentrating and spending money on their core business, as we say, which is treating patients, and not having massive parts of their estate taken up with boxes and files on shelves, not having staff tied up pulling records and putting records away and things like that. So this is about really diverting those resources back into healthcare. The direction EDM is going in is truly digital. And this is not about digitising paper and turning paper into electronic records. It's digital at source, so creating records from the start in a digital way.